We are endeavoring to change a culture. With patient and family-centered care, it means that the patient and family are part of a healthcare team.
Patient and family-centered care is about including patients and families in the care that they're receiving and in the operations of our organization. So asking them to include their voice and their opinion and their advice in guiding how we design policy and practice at Providence.
I think a patient and family-centered approach can really take our reputation as an excellent provider to the next level. Providence has 6 values, and when I think about each of those 6 values, spirituality, integrity, stewardship, trust, excellence, respect, I can't think of one of those that in some way doesn't influence an approach that's patient and family centered.
It's really about the planning, the delivery, the evaluation of care that we provide with our patients and families, and that patients and families are involved in all 3 phases of that. We have respect and dignity for patients and their families. We have information sharing in a way that patients and families can understand. So when I enter hospital, somebody can give me information, but I need to understand what it means. We also have what's called participation, so patients and families being involved in their care to the level that they feel comfortable with and wish to be engaged. And collaboration, which is at a much bigger organizational wide initiatives to be involved in, that we truly collaborate for changes that we're going to make in our healthcare system. And do we bring patients and families in? I believe we must.
What we needed was to increase partnership and collaboration with patients and families and actually invite them to be members at the table.
Patients have firsthand experience, and if there's any gaps in the care, we fall into them. So when you have a collaboration between the two, gaps in care or problems that can arrive are really quickly identified.
When Providence Healthcare started on our journey towards patient and family-centered care, we engaged with the Institute for Patient and Family-Centered Care. And one of their first recommendations to us was that we create a family presence policy that welcomes families at the choice of the patient to all of our sites.
What truly heals a person? What helps nourish their soul beyond the medicines that we give them, beyond the activities we make them be involved in? There is a connection that we all feel that we need to be connected to something greater than ourselves, and being able to support family members to come whenever they can is really enhancing that connection, supporting that connection.
We're building the hospital of the future, we're building the healthcare system of the future, and what we're doing here by incorporating patients and families as partners, as part of the care team, we have them embedded from our board level to our frontline leadership and quality teams, and that is going to be the model of the future, and Providence Healthcare is leading the way.
If you, as a health professional, can help that person and family understand more clearly about the disease and about the treatment and about the expectations of the healthcare professionals in terms of managing that treatment and what role you play as a family and patient in that, there'll be much more successful outcomes.